pretty amazing to see where we've come. After 10 years of holding these events, we started back in 2016 and really started with a focus on dental workforce, and every year they just get better and better. More people want to attend, we're learning more collaborations are happening.
It brings so many different people from so many different backgrounds. You've got educators, you've got practitioners, you've got health plans, you've got dental materials people, so many different people, nonprofits, medical, dental, and it's so nice to be able to connect with them and realize that we all care about the same thing.
I didn't realize how many people would come together and actually be so passionate about needing change on different levels.
We have the difficulty that so many people have a lack of accessibility and then a lack of method of actually paying for the care. And this just compounds not being well. You can't be healthy without oral health.
One dentist talked about the fact that a woman came and said, "My kids have terrible dental issues, remove all their teeth. I don't have any, they'll figure out how to do it without it."
And I saw kids that were not paid, being paid. I saw kids that waiting for 2 months, became 4 months, become 6 months, become 8 months. And I felt like this was a raging fire, and I was fighting this raging fire with just a garden hose.
We have a little over 3 million beneficiaries that are served in the state of Pennsylvania in the medical assistance program.
Unfortunately, those individuals do not have the same access to care that others do.
Currently, the adult medical benefit for Medicaid is not enough to incentivize people to provide care, and so there are no providers taking care of those patients.
Workforce is a huge challenge. It wasn't good before COVID, and then after COVID, it never really improved. And we really need to look at different ways on how we can manage having enough people to treat everyone who needs care.
We really need now, and where we've come, is that we absolutely need systems change. We just need to completely forget everything we've done and start over to get a different result. There's a very famous quote that every system gets the result that it was designed for.
I want every single Pennsylvanian to have access to good, quality, affordable dental care. And I think that's the mutual goal that a lot of the individuals that are here share. It's going to be hard, but we can do it.
One of the biggest changes that we'd like to see in the state of Pennsylvania is equitable access to care for all people.
I do think restoring adult dental benefits is really important for Medicaid, just because if we can show our adults that oral health is important, they take care of it, it's generational. It gets passed down to their children, the generations after that.
I would love to see us continue the conversations about the importance of oral health equity and creating access for individuals who don't have the resources to do so for themselves.
We heard excellent presentations about some really innovative programs to address those areas by training people in rural communities, and then hopefully they'll practice there as well.
If someone trains in a rural community, they're more likely to someday practice in a rural community. That's the whole basis for this initiative.
Usually in rural areas, because there's not much there isn't really much of a need or a want for them to stay in the area. We're doing various different things to try to immerse them in the community, to get them to enjoy the community where they're at.
Gone are the days of just saying, you gotta fill a tooth, you gotta drill it, clean it out, fill a tooth. There's so much more that we could do now. It's very exciting.
Our dental careers are really limitless at this point. You might be a dental hygienist working in a hospital on a labor and delivery floor. That's a very different model than what we used to have. You're not just stuck in a brick and mortar building cleaning teeth all day. You might be doing educational programs for new moms, new families. There's a really cool sort of trend to this interprofessional collaboration.
I see it in action here. It is so effective. People need to come together cross-sector and get to know one another, develop trust, iterate, have these creative ideas, right?
The thing that I would say is very important about PCOH is their ability to collaborate across the spectrum. They look at the perspective of the patient, the practicing clinician, the legislative perspective, and also they include dental schools.
One of the things that has motivated me is seeing the level of collaboration that's happening. They're all working together to see how we can partner to create better access to care across the state of Pennsylvania.
I love engaging with everybody from clinicians to educators to state representatives. Everybody has so many pieces to offer to puzzle piece the work that goes into improving oral health.
For me, like being a new grad, soon coming out into this field, it was a really cool experience, and if anyone has the opportunity to come to this, I really think they should.
It brings together individuals who care deeply about the underserved population, individuals who are working very hard to promote oral health care. No better place to be than here at the Oral Health Summit if you want to learn and also contribute in a collaborative way.
As a person who now works in a more corporate world, sometimes you get kind of burnt out, and you come to these conferences and it reinvigorates you and it makes you really remember like why you got into this in the first place, and that is good to the soul.
Oral health is very crucial to overall health, and a lot of people don't understand that or don't know. So I think what we need to do as advocates for oral health is get that knowledge out to everyone.
Just do it, just be involved, sign up as a stakeholder, donate money if you can, and if you can't, the best thing that you could do is just be a voice to speak out for people about what we need for oral health.
If you have a passion for it, I'd say go for it. You are constantly helping people in your community and even on higher levels.
I've never done anything that's this much fun in my life and gotten paid for it. We get to make people smile every day.
A healthier Pennsylvania comes from everyone being able to access dental care.